Hey, so all welcome back to my YouTube channel. Today we are going to discuss about the dentin. Basically, they are S-shape in they are either sigmoid shape, they are either doubly curved structures. They begin at right angle from the pulp to the dentino-enamel junction and to the dentino-cemental junction. At the crown, they have a diameter of 2 to 3 microns, and the ratio between the DEJ to the pulpal surface is 5:1, and the ratio between the pulpal surface to the outer surface of dentin is 4:1. All of you have to remember these points. Next, we are going to study about what is peritubular dentin. As per the name suggests, peritubular dentin, and also about intertubular dentin. Intertubular dentin. Suppose this is our dentin, these two are dentin. As per the name suggests, intertubular, that is between the tubules. Okay. So these two circles show the dentinal tubules. As per the name suggests, intertubular, that connects, that is between the two tubules. So this is called as intertubular dentin, and peritubular dentin is also called as intratubular dentin. Basically, this surrounds the dentinal tubules. They are also called as intratubular dentin. Okay. What is peritubular dentin basically? Peritubular dentin or the intratubular dentin is highly calcified. Okay. With increase in age, they get thickened. Okay. They are not seen in demineralized tooth sections. As we have said, that lining of it is the dentinal tubules is called the peritubular and the intratubular dentin. The inner calcified mass of the peritubular dentin, this calcified mass is called as lamina limitans. What is lamina limitans? Lamina limitans is a calcified mass that surrounds peritubular dentin. Okay, this lamina limitans is rich in GAGs. What is GAGs? It is glycosaminoglycans. Okay. I think all of you have been thorough with this, the peritubular dentin and the intertubular dentin. Okay. Lining of the peritubular dentin is called lamina limitans. Around the dentinal tubules we have the peritubular dentin, and between the dentinal tubules we have the intertubular dentin. Amongst the peritubular and the intertubular dentin, highly calcified is the peritubular dentin. Okay, I will write down here for all of you. Highly calcified among the two is peritubular dentin is more calcified than intertubular dentin. Okay. So first of all, something called lamina limitans, and this peritubular and the intertubular dentin. Okay. Next we are going to study what is predentin. Predentin is basically the first unmineralized dentin, and this predentin is present throughout the life around the pulp. Okay. So this is basically about the pre-dentine. Then there are various other types of dentine like mental dentine, circumpulpal dentine. Okay. So firstly, I'm making a diagram here. All of you should understand. This is enamel. This is dentine. The dentine has scalloped margin and the convexity of it is facing towards the dentine. Okay, convexity facing towards dentine. Just immediately below the dentine, the first layer of it is called as, I'm making like this so as to differentiate. The first layer below the dentine is called as mental dentine, and beneath the mental dentine we have the circumpulpal dentine. Circumpulpal dentine. Okay, so what are the important things that you have to remember about the mental dentine is that firstly it is present just immediately below the dentine, and below the mental dentine is our circumpulpal dentine. Okay, this all of you should remember. First of all, mental dentine. What are the features of mental dentine? Mental dentine is less mineralized. They have the less defects as compared to circumpulpal dentine, and they contain the important fibers that are called as the von Graaff fibers. And more importantly, they consist of type 3 collagen. Okay, these are the important points that all of you have to remember, that mental dentine is less mineralized, they have the less amount of defects, and they contain the von Graaff fibers which involves the type 3 collagen. Then what are circumpulpal dentines? Most importantly, the circumpulpal dentines, they contain phosphoporphyrin. Okay, and they are formed prior to root formation. Okay, most importantly, in the mental dentine you have to remember about the von Graaff fibers, and in the circumpulpal dentine you have to remember they consist porphyrin can also be seen. Okay, these are the important things that all of you have to remember about this. And circumpulpal dentine is highly mineralized, just like mental dentine is less mineralized. Okay, so all of you have to remember these points. And one more important thing is that mental dentine consists of matrix vesicles. Okay, firstly we studied about the peritubular dentine, then about the predentine, then something about the mental dentine and the circumpulpal dentine. Mental and circumpulpal dentine. Okay, what is the first unmineralized dentine? That is predentine. Okay, sorry, first unmineralized dentine is the predentine. What is the dentine that is formed just below the DEJ? That is called as the mental dentine, and below the mental dentine is our circumpulpal dentine. Okay, then we will study our primary dentine, our secondary dentine, and our tertiary dentine. Okay, tertiary dentine, it is also called as reactive dentine. Okay, and secondary dentine, it is also called as aging dentine. This secondary dentin continues to form throughout our life. Throughout our life, all of you have to remember that secondary dentin continues to form throughout the life. Okay, this is the most important thing that all of you have to remember about the secondary dentin. Okay, amongst the primary dentin and the secondary dentin, primary dentin is highly mineralized as compared to secondary dentin. Okay, it is called aging dentin because as the person advances, as the person's age increases, its formation also progresses with it. Okay, now we will study something about what is called pulp recession. What is pulp recession? Pulp recession is basically when the secondary dentin forms on the floor of the pulp chamber that leads to decrease in size as well as shape of the chamber. This is called as pulp recession, followed by there will be a bend between the primary and the secondary dentin. Okay, what is pulp recession? There is deposition of secondary dentin where on roof of pulp chamber. Since decreasing size, shape of chamber. Due to this, what will happen? I am making it by a diagram. Suppose this is our primary dentin and this is our secondary dentin. So here it will be showing a sharp bend. Okay, so pulp recession occurs because of secondary dentin can also be found. Okay, what is the type of dentin that occurs due to the abnormal stimulus? The tertiary or the reactive dentin, also called as the reparative dentin, also called as irregular secondary dentin. Basically, it occurs due to the presence of any abnormal stimulus. It can either be any kind of trauma, mechanical, thermal, or microbial. Okay. Basically, tertiary dentin can be of two types. It can either be reactive or it can either be reparative. Reactive is due to any kind of noxious stimulus or any trauma. Okay, so basically you have to remember the tertiary dentin. Basically they are resistant to that of caries. Okay, then there are certain incremental lines that you have to remember. It is very confusing. Okay, in the case of enamel, in case of dentin, and in case of cementum, we have different incremental lines. I am mentioning all of it here in front of you. You have to remember. In the case of enamel, we have incremental line of Retzius. In the case of dentin, we have incremental line of von Ebner. And in the case of cementum, we have incremental line of Salter. Okay, these are the incremental lines formed in the case of enamel, dentin, and in the case of cementum. What are the incremental line of von Ebner? Basically, it involves the daily, rhythmic, recurrent deposition of dentinal matrix. Okay, and when there is increased and the prominency of the incremental line, then it is called as contour line of oval. So what is incremental line of von Ebner? I am mentioning it here. Daily, rhythmic, recurrent deposition of Dentin matrix. Okay, when this gets hyper excited or the accentuated, then it is called as the contour line of oval. Okay, then there is something what is called neonatal line. Neonatal line. Neonatal line is not seen in each and every teeth. Basically, it is seen in primary teeth or our deciduous teeth, or they are seen in permanent teeth involving the molars. Okay, only our first molar. Okay, rest in all of teeth it is not present. Okay, or you can either see in dentin of lower incisors. These two are the basic criteria of the neonatal line. Okay, there is something called as neonatal line. I think it is clear to all of you. Okay, now we will study about the theories of pain. Basically, there are three theories of pain. Firstly, I am mentioning here the name only, is direct neural theory. Then there is transduction theory. Then there is hydrodynamic theory. What all you have to remember about the three theories is that most common followed theory is our hydrodynamic theory. Okay, most common followed theory is our hydrodynamic theory. Okay, as per it, inward movement and outward movement of fluid occurs when there is a cold stimulus present. Then there will be inward movement, and outward movement when there is a due to drying or hot conditions of the exposed dentin. Okay, most important theory is the hydrodynamic theory. Then what are the age related changes of dentin? Age related changes, as all of you have always heard about what are dentinal tracts. Okay, dentinal tracts or the dead tracts, all of us get confused. What are seen in reflected light, what are seen in transmitted light. So dead tracts appear dark in transmitted light and white in case of reflected light. Dark in case of transmitted light and white in case of reflected light. Okay, so basically what are dead tracts? Here dead tracts are basically our dentinal tubules are filled with air. Okay, it has a most common disadvantage that it causes increased bacterial intake. An advantage of it is that it has less sensitivity. Okay, first of all we studied about dead tracts. Next is our sclerotic dentin. Sclerotic dentin is opposite to that of the dead tracts. They appear dark in reflected light and white in transmitted light. Okay, all of you have to remember it. These two can be asked in viva, which appear dark in transmitted light, which appear light in reflected light. So you have to remember all of this. And in the case of mental dentin, I have already mentioned that They consist of von Kropf fibers. Von Kropf fibers basically are crop corkscrew fibers, like they have the shape like it, okay, and they can be silver stained. Okay, now I am going to tell you about hardness, some important points about the dentine. Physically and chemically, it represents similar to that of the bone. Hardness, it is very confusing. We will always get to know that bone is the hardest substance. Among in our dentine is harder than bone, but enamel is harder than dentine. All of you have to remember this. Amongst the bone and dentine, dentine is the hardest, but enamel is the hardest substance in our body. Okay. Next, the Knoop hardness number of dentine is around 68. Okay. And then dentine has highest of tensile strength. All of you have to remember this. So basically in today's lecture we have studied something about dentinal tubules, peritubular and the intertubular dentine, what is predentine, mental dentine, circumpulpal dentine, primary, secondary and the tertiary dentine, and what are the incremental lines involved in the case of enamel cementum as well as dentine. Where are neonatal lines found? Most common theory of the pain of the dentinal tubules is hydrodynamic theory. What are the age related changes? What structures are seen in dark and transmitted and reflected light? Okay, so this is all about in brief about the dentine. I think this video will help all of you somewhat. Okay, so this is all for today's class. Please do like, share and subscribe my video. Thank you for watching. If there is anything you want to ask or any queries and any suggestion, you can type in the chat box. Thank you so much.